Hi and welcome to this video with a very interesting topic. And if you have any knowledge at all about this, please comment below and let's share experiences, because there's not really a lot of science around this. There are some facts that has been shown regarding hormones and tissue and fascia in the pelvic floor and the vagina, but that doesn't really correlate with all of the stories that I hear from women from around the world. So if you have anything to add to this video, please do it. And we are going to have a look at two different scenarios in this video. One is women still having a menstrual cycle, and the other one is women in menopause or after menopause. Let's start with women having their menstrual cycle. As most of you probably know, there are two hormones playing a crucial role. There are more hormones, but the big ones for women throughout a monthly cycle is estrogen and progesterone. And in the beginning of the cycle, so day one is when you have your period, and in the beginning of the cycle, estrogen rises all the way until you ovulate. So once you ovulate, slowly estrogen decreases. It may decrease and rise a little bit, but in general it decreases. So estrogen's role in the female body is actually to make it kind of plump and like fluid and juicy and all of those things. So it makes us become, you maybe want to say, like more vital in the tissues. So in the pelvic floor, then obviously you will have more fluidity, more circulation, and more of that plumpness and fullness that may help to stabilize all the tissues and support the tissues to kind of hold them up. After you've had your ovulation, progesterone will start to rise. So as estrogen lowers, progesterone rises. And for progesterone, this type of hormone does not really make the tissues plump or full or vital in that sense. They may become more dry. It may be less of that fluidity. And it does not have to be a drastic change, but if, like in nuances, this may be that the direction that the tissues will take. And toward, before you're getting your cycle, like a week before, a few days before, it may be that the tissues are as dry as they will get throughout the cycle. And then you have your period, and then it starts all over again. And what I hear from a lot of women is increased symptoms, prolapse symptoms mainly, just before they have their period. And it makes a lot of sense if you look at the hormones and how they are working in the body. So if you have increased prolapse symptoms like heaviness, chafing, bulging, just feeling less support in your pelvic floor just before your period, it may be that, you know, your tissues is kind of getting drier. It may also be that in the uterus, slowly blood is building up. That lining of the uterus will become thicker, and the body is ready to prepare for sending all the blood there. So there may be some heaviness from the actual uterus, which also affects the positioning of all the organs in our pelvic floor. So those two in combination may be a reason why women experience more prolapse symptoms right before they have their cycle. So this perspective, according to me, would be the more theoretical perspective, where kind of things make sense according to the hormones. The thing is, though, that I hear a lot of stories where women actually have increased symptoms right before ovulation. which does not really make sense according to this theory. But I do, of course, believe that they have increased symptoms. And why is this? We cannot be sure. So here I just want to give you some perspectives, and it may be that you have symptoms, increased symptoms, after your period or anytime during your cycle. So this perspective that I'm going to give now is more for when it doesn't make sense. Our pelvic floors are like a jellyfish. If you've seen a jellyfish move in water, it's, very, very fluid, and it's never stagnant, it's never static. It's always moving, it's continuous movement, and one part may go like this and the other one like this. And this is actually how we can look at the pelvic floor too. Maybe with less movement, of course, but the pelvic floor is not like our hand. Like our hand will look kind of the same every single day. And for our pelvic floor, that is not the case. And I talk about this in other videos, and why it also may be hard to get like a diagnosis. For many women, they experience a lot of changes, and it's just depending on what day you are getting that diagnosis, rather than that diagnosis is true for every single day of your life. So back to some perspectives on why are you having maybe increased symptoms any other time than right before your menstrual cycle. So this movement in the pelvic floor, how it shifts, it's definitely depending on the hormones. And here we also need to look at the balance or imbalance in women's hormones, because it may be that there is a big imbalance or just an imbalance that will also play a role in how your pelvic floor and the tissues, the mucus tissue, is holding up itself. So if you have like a shorter period, if you have spottings, if you have a heavy PMS, like all of those symptoms are also showing imbalances in your hormonal cycle. So I would definitely address that for your pelvic floor health. So that is one perspective. The other one is that our pelvic floor will react to the situation that we are in. If we have a lot of stress, if we have maybe like a lot of grief, if we have PTSD, maybe from giving birth or something else, if we have lack of sleep, and all of those cases, that will also affect our pelvic floor. So this may be a reason to why you may be experiencing more symptoms just randomly throughout your cycle. I also want to add to that one what you eat, like how you spend your time, basically. If also the light environment will have an effect, like if you have a lot of blue light into your eyes all day long and you don't get sunlight in the morning or throughout the day, like how you take care of your body will definitely play a role, not only for hormones, but also for your pelvic floor. And they are so intimately connected. I just want to share a last scenario for women still having their menstrual cycle, which was my case. And that was to have increased symptoms randomly all the time. So I could never really make sense out of the hormone perspective for my own healing journey, because throughout a cycle, a menstrual cycle, my healing cycle was like this. And then after a few months, more like this. And then after a couple of years, more like this. And I could never correlate the hormones and how I was healing. But I did work a lot on my hormonal health. So this is when I took a course to learn the Justice method, which I am super grateful for, to be able to see, my secretes, to track my cycle. It's a really important thing, not only for your overall health, but for your pelvic floor health too. So I highly recommend diving into that perspective if you have not done that yet on your healing journey. So that's the menstrual cycle part. Now let's dive into the menopausal perspective. And from a theoretical perspective, we all know that estrogen goes down as we enter perimenopause or menopause or after menopause. So what happens then? Well, for many women, what happens is that suddenly symptoms arise. And it may be that they have had symptoms right after they gave birth. And it may be that they have had symptoms right after they gave birth, but they kind of disappeared after 6 months, 1 year, 2 years. So they never bothered to have a look at it. But then for so many women, these symptoms comes back as estrogen lowers. And this is one of the reasons that doctors recommend to take estrogen locally in your pelvic floor, in your vagina, to help the tissues become more plump and fluid again. And for me personally, I would definitely try more natural therapies to make that happen before I take any kind of non-biological or like estrogen that my body has not produced. But that's up to every woman, of course, to make that discovery and what works for her. So many women are experiencing more dryness in their vagina, in their pelvic floor after menopause or around menopause. And the dryness itself may be a really bothering symptom, but also, of course, any prolapse symptoms like heaviness, bulging, chafing, like this area becomes very like just dry and not that vital and all of that. So here comes definitely all the tools in that I share on this channel. Hypopressives, for example, will start to increase the fluidity again in your pelvic floor. Block therapy will do the same. Like all the methods here will do that. It will start to vitalize your pelvic floor again. And of course, not having estrogen will give some kind of effect in the body, but we can help the body and support the body to not have those kind of severe symptoms related to the dryness. So if we can help with blood circulation and vitality in this area, we can also decrease the symptoms without interventions. So there's one more case that I have not mentioned, and maybe I will go into that in another video. That is the case of pregnancy and postpartum and breastfeeding, because different hormones will play different roles during this time too. So just be aware if you're in that situation that it may be a totally different experience. But today I wanted to focus on the menstrual cycle and the menopausal situation. So I hope this video gave you some clues to have a look into your own hormonal health and correlate and how you can kind of track your pelvic health with your hormones. Good luck.